Welcome everyone, my name is Dr. Yunus Baghdadi, and if you as a dentist would like to know how to better close a deal and sell a treatment plan as a dentist to the patient by respecting the ethical rules of dentistry, let me share these 5 tips with you which helped me a lot to improve my skills and which you can implement in your everyday dental practice. So the first one is earn the trust of your patient. We all know as a dentist that good and effective time management plays a huge role in our everyday dental practice, but you should always have a few minutes of small talk before jumping right into the treatment plan and asking specific questions about the patient's pain, problem, complaint. And by having a personal conversation in the beginning, by, for example, asking them where do they come from, what's their profession, what are their hobbies, you can build a little trust in the beginning, and the patient wouldn't feel uncomfortable at all in the future to work with you. So the second one is ask the question, why do they came now? It's an important question because you can filter out things which can help you to save time in the future. Let me give you an example. One of my patients came to the clinic and I asked this question. He started talking about his personal life, like he had a big heritage and he earned a lot of money. Therefore, he felt comfortable to came to the clinic because whatever the price is, he will be prepared to pay the amount of money for the actual treatment. So I didn't have to negotiate with him on the price about the treatment plan, and I saved time with this. So the third one is ask them about their actual pain, complaint, and what's their end goal, and restate their problems. So the patient basically will tell you that I have pain here, here, I want to solve this, and my wish is to have something fixed in my mouth, whether it's a bridge, implant, with which I can eat again normally, I can chew and I can enjoy my meal. And what you have to do is restate all of this. So you need to tell the patient that, as I understood, you have pain here, right? Yes, okay. And you imagine something fixed denture which will make you able to chew again, and you will be able to enjoy your meal and eat normally. Right? And by doing this, restating the problems and making the patient say yes, you will reinforce subconsciously in the patient that how much important is for them to solve this kind of problem, which is really powerful. The fourth one is be simple, don't be too professional. Try to articulate and explain the treatment in a way that everybody could understand. The patient don't give a damn about how you're gonna put the implant inside the bone or how you're gonna drill the cavity, how you're gonna prepare the tooth. The only thing that the patient care about is to have something in their mouth which works, which has a function, which looks good, and which makes them look good. This is the only thing, so don't try to overcomplicate things, because you can even scare the patient and the patient doesn't care. So be as simple as possible. The fifth one is differentiate the objections. If the patient has an objection or concern, issue about the treatment plan, you should ask them the right questions in order to differentiate whether it's money, fear, or trust problem. Let me give you an example. If the patient, if you think that the patient has a money issue, you should ask them the question, if money wasn't a problem for you, would you sign the treatment plan or would you start the treatment? And if the patient says yes, then it was a money issue. And if you know in the beginning that the patient has no money issues at all, but still has a concern about the treatment, you should maybe ask them if they are scared of dentistry in general, or if they had a bad experience with a treatment before, because if yes, you should gain more trust from the patient, and you should let them know that this is painless and they can trust you because they are in good hands. So always try to differentiate the issues of the patient.